Dr. John Torres here with NBC News. Dr. John, as they call me, covering some headlines you've probably heard over the past few days or so. We're going to get our audio fixed here real quick and I'll restart. So let's go with NBC News. Dr. John, as they call me, covering some news you've probably heard over the past few days. And what I like to do is go over a few different topics, 3 topics in particular, and talk about what those topics mean, get below the headlines, because sometimes the headlines can be a bit confusing, maybe even misleading, and get a better understanding of what that news means, and particularly what it means for you, your family, your loved ones, and your community. And hopefully some of this information helps you decide what you need to do to stay safe and help us get through this pandemic. And then after that, I take questions and answer those as many as I can, as best as I can. So please send us your questions. We have some really good ones, and typically, and so I think we'll have some great ones today as well. So first, let me start with the different headlines. Number one, probably the biggest headline today, we have achieved, unfortunately, it's not something we wanted to achieve, but we have gotten to 7 million cases of coronavirus here in the United States. 7 million cases, over 200,000 deaths, unfortunately, are associated with that. And according to some predictions, there is one model, and by model I mean predictions, that a group is making. This is a group called the Institute for Health Metrics and Evaluations, the IHME. And it's the one that tends to be one of the more accurate ones. Well, a few months back they predicted by October we'd have 200,000 deaths. We're there. And now what they're predicting is by January 1st, we could possibly have 378,000 deaths. And that's assuming that things go along the way they're going along now, and that people don't start taking more serious those measures that they know they need to do in order to stay safe. But putting it in a bit more perspective, if you look at the numbers over the past few months, and I'll just go through numbers here briefly. Looking back, and these are CDC numbers, on the 6th of March, there were 211 cases of coronavirus reported in the U.S. 211 on 6th of March. 18th of March, so we're talking just 12 days later, less than 2 weeks, 10,000 cases. It went from 200 to 10,000. 27th of March, so we're talking 9 days later, it went up to over 100,000, 103,000. And so it multiplied by 10 in just 9 days. 28th of April, a month later, 1 million cases. 11th June, 2 million cases. And now we're up to 7 million cases. So you can see this curve is basically going, instead of going slowly along like this, it is going exponentially higher. And that means that we're not controlling it as best we can. And there are things we can do to hopefully keep it better under control. This 7 million cases, it was 6 million 31 August, so just 25 days ago, it was 6 million. And the problem is what we're seeing here in the country are spikes in certain areas around the country, particularly Wisconsin, Minnesota, Iowa. They're starting to see more cases and they're concerned about their hospitals getting overwhelmed. On the one side of this, though, there aren't as many hospitalizations. The deaths haven't been there as much either. And part of that's because of who's getting affected by this. It tends to be younger adults being affected who don't get those hospitalizations or deaths as much, but it's a bit of a complicated picture because we won't really know about hospitalizations or deaths for a while because those tend to lag. First we get cases, and then over the next couple of weeks those cases turn into hospitalizations, and over the next couple of weeks some of those hospitalizations unfortunately turn into deaths. And so it certainly lags. We expect hospitalizations to go up, we expect deaths to go up, but not to the numbers they went up back in March and April timeframe. And so that's just showing that, yeah, we are doing things to help keep the pandemic under control. It's not as bad as it could be, but it's not as good as it could be either. And that means, and I know it's boring, the 4 W's I talk about all the time: wear a mask, watch your distance, at least 6 foot minimum, wash your hands or use hand sanitizer if you can't get to a sink, especially before you touch your face, and windows. Open windows to ventilate as best you can, because that open air and doing things outdoors instead of indoors can dilute out the virus. So that is one news article that's been happening over the past few days. But on top of that, and this kind of segue into that, is Europe itself. Some countries in Europe are having issues, and they're having dramatic increases in cases. As a matter of fact, they're having cases that are much higher than they had even back when they were having their first wave. And in Europe, it's always arguable whether here in the U.S. we're actually going to have a second wave, whether we finish the first wave, whether those 2 waves are just going to morph into one big wave. In Europe, you could argue that they went through their first wave and things got much better. And part of that was because of a lot of the lockdowns that were instituted. UK, France, Spain as the best examples, they got things fairly well under control. Problem is, then they just opened everything up and people went back to prior behaviors. People were congregating in groups, in bars, in restaurants, weren't necessarily doing the social distancing or the mask wearing. And the problem is now we're seeing results of that, and we're seeing huge numbers of cases. And I'll give you examples. In Spain, they're reporting 11,000 cases of coronavirus a day right now. In the UK, 6,000 cases. In France, 16,000 cases. And to put that in perspective, because of their populations are much smaller than ours, what I've done is I calculated that out based on our population, if we had the same size or if they had the same size as us. And so Spain, 11,000 cases. If they were the same size as the U.S. in numbers, that's equivalent to 55,000 cases a day here. UK, 6,000 cases, that's equivalent to 42,000 cases a day here. In France, unfortunately, is at the highest here, 16,000 cases a day. The equivalent here in the U.S. would be 80,000 cases a day. Now, we've been at those numbers. We're down to around 40,000 a day, so we're doing much better. But Dr. Fauci and other experts are saying we truly want to get below 10,000 a day. But not all Europe are having the same problem. If you look at Germany, they're 2,000 cases a day. That's the equivalent of 8,000 cases a day here. That's a number we would love to have. Sweden, even though Sweden got a very hard time for keeping things open, they're down to 400 cases a day. That's the equivalent around 12 or 13,000 cases a day here. Again, numbers that we would like to have, even lower than that. But one of the big differences, when you look at Germany, when you look at Sweden, they're very good at following those 4 W's I was talking about. The wear a mask, watch your distance, wash your hands, and open windows. Spain, UK, and France weren't following those as closely. And so what this is showing is following those measures, even though none of us really want to do that. We are tired of doing that, can really help get this under control and keep it under control, which is more important. And the one warning here is that here in the U.S., once things start getting better under control, we don't want to get right back to where we were or even worse. So you have to keep those measures going. Even though things around you might look better, you want to keep those measures going to keep them better and to keep getting through this pandemic. One of the things that's going to help us is the vaccines when they come about. And right now there are 4 vaccines that are in the front runners considered here in the U.S. for the vaccine to come out first. Moderna, Pfizer, Oxford, AstraZeneca, which is one, and then Johnson & Johnson. A few differences in the vaccine. 3 of those are double vaccines. You have to get one in day 1 or day 0, and then a second dose day 21 or 28. Johnson & Johnson is a single vaccine. Some of them are testing 30,000 people, Johnson & Johnson 60,000 people, the Oxford one 30,000, Pfizer 44,000, Moderna 30,000 people. And so you can see there's a few differences there in how the vaccines are made, how the vaccines are tested, and how they're going to be implemented. But to help with that, the Senate had a hearing this week, and they had the 4 big administrators on there talking to them. One was Dr. Fauci from the NIH. The other was Dr. Redford from the CDC. Dr. Giroir, he's from the NIH as well, but he's the testing guru, essentially. And then Dr. Hahn from the FDA. And what they tried to do, because there's a lot of vaccine hesitancy here, is they tried to give an understanding of what they're doing to try and get the public trust in this vaccine, because they know that getting the vaccine distributed, getting it produced and distributed is one thing, but getting it to where people are actually willing to take it is another thing. And a lot of people are hesitant at this point. They're a little concerned about how fast they're doing it, so they're trying to alleviate those concerns. And here's some quotes that Dr. Hahn in particular came out with. He said that he's going to inform the public, except for things that are confidential, meaning that if it's patient information, as in a patient's name or other medical conditions, you can't do that because of the way our laws work. The public is going to be allowed to comment before this emergency use authorizations, and the FDA is not going to authorize anything until certain criteria is met, and they're expanding that criteria. And the thought is they're going to expand it so people have to undergo testing for longer periods of time, and they have to test more people of various age groups, and they have to make sure that people, especially in a placebo group, have gotten not only mild to moderate disease, which is easy to get early on, but also severe disease, which we don't want them to get, but for testing purposes can certainly help out to see if the vaccine works against those. And his quote, "Science will guide our decision." And his other quote, "I will fight for science." And when I asked him about a timeline, he said, "I have no idea on the timeline for the emergency use authorization. Science and data is going to drive that timeline." And the others echoed this the same. And one interesting thing is they asked them, would you get this vaccine? They asked the panelists, would you get this vaccine, and would you give it to their family? And they all said, if science looks good, if the data looks good, and if it's gone through its emergency use authorization appropriately, I would not hesitate to get it myself. I would not hesitate to try and talk my family into getting it, or at least advising them to get it. And I think that will go a long way towards getting people to trust more the vaccine, getting that transparency. And they look like they're taking another step, which I think they should be taking, is opening it up to public experts who can look at it, public panels who can look at it and who can say, let's definitely look at the data, fully look at the data, have an understanding of what they did, how they tested, what the results are, and whether we think there should be an emergency use authorization. We'll advise the FDA on that as well. And that way everyone understands what's going on. It's been very transparent. And I think now is the time to make sure that that's happened. But again, let me just go through the headlines again very quickly, and then we'll get to your questions. Number one, 7 million cases. We've reached that milestone. 200,000 deaths, a grim milestone that we've also met. According to some projections, over 300,000 deaths by January 1st. And we just need to make sure that we buckle down and do those things we need to do, and we can get that number lower. Europe, some countries are having issues, other countries not as much. The ones that are having issues are having what some are calling the second wave. Seems to be because they've opened up things too quickly, they've relaxed their standards too quickly, and those coronavirus cases have really moved in. And then the last one, the vaccine. The race for the vaccine is heating up. Senate had a hearing. They had the 4 big administrators, Fauci, Redford, Giroir, and Hahn in there talking about the vaccine, trying to get public trust in the vaccine. But as to when it's going to happen, it's anybody's guess. My guess, most experts are saying early in the year, maybe springtime before we start seeing that. So now let me see if you have any questions.
Please explain why COVID-19 is not like the flu.
So the question is, why is COVID-19 not like the flu? For a couple of reasons. Number one, if you look at the flu statistically, we have 30, 40,000 deaths a year because of the flu. We just talked about 200,000 deaths already because of coronavirus. On top of that, coronavirus seems to spread quicker than the flu. They're both respiratory viruses, but coronavirus seems to spread quicker than the flu. And it doesn't give as much what we call morbidity. It doesn't make people as sick. And part of the reason we think that happens is, number one, there's the flu vaccine. Highly encourage people to get it starting now. Make sure you get it by the end of October, particularly by Halloween. That way you're ready for the flu season to come here. So number one, we have the vaccine. But number two, because people have been vaccinated over the years, because people have been exposed to flu over the years, it's not a new virus, even though it's mutated to be a different strain. It's not a new virus. So our body, to a certain extent, can mount some defenses, at least limited defenses. That flu vaccine helps you mount better defenses. And so it can help keep you from having this, what we call morbidity, again, bad symptoms and bad disease from the flu. With coronavirus, it too is a virus, but it seems to spread quicker, seems to spread easier, and it's what we call a novel virus. It's something our bodies have never seen. Our immune system is naive to it. And when that happens, two things happen. One is we don't know how to fight it very well. So when a virus gets into our body, immune system cannot mount its defense initially fast enough, and so that allows the body to replicate, or the virus to replicate inside our body and get to a point where it's really hard to kick out. It's really hard for the immune system to fight. On top of that, since it is a novel virus and our immune system is naive to it, it doesn't quite know how to attack it. It doesn't know the specifics on what it needs to do to attack it, and so it produces an overwhelming immune response. That overwhelming immune response not only attacks the virus, but also starts attacking the body, and that's the cytokine storm that you often hear about, that's one of the main causes of people dying from coronavirus, is the cytokine storm, their immune system basically kicking in and causing its own damage inside the body. And so those are probably the biggest differences. And something to think about as well is, again, we have the flu vaccine. You can get the vaccine, which will protect you from getting the flu. It'll certainly help. And even if you get the flu, it'll protect you or help protect you from having complications of the flu, and it'll help protect you from dying from the flu. Big important things. We don't have that with coronavirus yet. But part of the speculation is, will we have a better flu season, because we're doing so much to protect ourselves from coronavirus? Nobody knows. If you look in Australia has had a better flu season because of the measures they've implemented from coronavirus. But they're much better than we are implementing those measures. They've had very low cases. Even though they've had outbreaks that they shut the country down, they've had very low cases of coronavirus compared to the United States. And so again, this is one of those things that you have to realize that might not happen here. We're hoping it's a good flu season, as in low numbers, but we don't know. So the best defense for you is to get your flu shot. It helps you and it helps your community, and it certainly helps your hospitals out, that they don't get inundated with flu cases.
COVID-19 COVID-19 is airborne, right?
So COVID-19 is a respiratory virus, and it is in the air. Now I want to give you a couple of definitions here. When you say airborne, what we typically think of by airborne is, yes, the virus is in the air, but then it breaks down into how is it in the air, how long does it last into the air? And this is where it gets a bit confusing, because you've probably heard respiratory droplets versus aerosolized droplets. The big difference here, they're both airborne droplets. Respiratory droplets, we breathe, we cough, we sneeze, we talk. Those respiratory droplets come out. They tend to be bigger and heavier. So the virus itself can't move around. The virus itself can't fly. So it depends on these respiratory droplets to get it projected through the air. Respiratory droplets, usually they're 0.3 microns or bigger. And so they tend, in most cases, 0.5 microns or bigger. So they tend to be big and heavy. And when that happens, they can't go very far. And so typically 2 to 5 feet, 3 to 5 feet is the distance they can go. If somebody's normally talking or somebody's breathing, if they're shouting or screaming, definitely, or sneezing or coughing, definitely much further. But typically 3 to 5 feet. And that's why we say 6 feet is a minimum distance. You want to make sure you do that. But part of the issue is we're now finding out that the coronavirus actually probably has some components of an aerosolized droplet. Now, an aerosolized droplet is a much smaller droplet, and it's usually less than 0.3 microns. The issue with aerosolized droplets is they aren't as heavy, and so they don't fall directly to the earth like the other droplets do. They float around for a little bit. And luckily, these ones are big enough, at least we think they are, where they're not going to float around very well, but they can certainly float around for a little bit of time, more so than the other ones, and they can go further. And that's why some experts are saying, okay, 6 feet is the minimum. The further away you can get is better. And if you're outdoors, even 6 feet, you want to wear a mask, because you never quite know when that aerosolized droplet is going to be around in the air. And this is even more so for being indoors if you're with people who aren't in your quarantine circle. And so that's the big difference. And I fully understand the confusion between the two. So both of them are airborne. But you have the respiratory droplets, which don't go very far, and the aerosolized droplets, which can go further and hang out longer. But most experts believe that the majority of people catching coronavirus catch it from those respiratory droplets. And that's why 6 feet, wearing a mask, is the advice we're getting right now. So.
Did more people die of the swine flu and the bird flu than COVID-19?
So the question is swine flu, bird flu, COVID-19. And I get this question a lot, especially from people who think that COVID-19 has been overblown. And they say, well, we had the bird flu, we had the swine flu, caused many, many more issues. Well, if you look at it, going back in time. So in 2003, that's when we had the avian flu, which is the bird flu. It's H5N1. And the reason it's called bird flu is it came from birds. It came from birds, particularly fowls, chickens were the main source of it. Luckily, it didn't really progress to the point where there was rampant human-to-human transmissions. There were limited cases, especially in people who were in close quarters, as in people who lived together or blood relatives, but there weren't that many. Around the world, around 600 deaths from the bird flu. Here in the United States, there were no real cases of indigenous bird flu. There was a case of somebody coming in, but they brought it with them, and no deaths here in the United States. That's the bird flu, the H5N1. Fast forward to 2009, this was the pandemic, H1N1. That's the swine flu. The H1N1, yes, it was bad. But if you look at the statistics here in the United States, 60 million cases, 12,000 deaths. 60 million cases, 12,000 deaths. Compare that here in the U.S., 7 million cases, 200,000 deaths, and we're only 8 months into this. And so again, here we had 60 million cases, H1N1, 7 million cases coronavirus, 12,000 deaths, H1N1, 200,000 deaths coronavirus, and again, we're not even through this pandemic yet. And so you can see that the H1N1, the concern back then was, yes, it did have human-to-human transmission, and that's why you're seeing bigger numbers and you're seeing more deaths, but than you did with the swine flu. But you have to realize, too, that that was fairly well under control over time, and then it eventually came back to where it has been kept under control throughout the country or throughout the world, with experts keeping a very close eye on it. But the coronavirus isn't even close to that point yet. So when people tell me, yes, we had the swine flu, we had the bird flu, why are we so worried about coronavirus? Well, if you look at the numbers, that's one reason to be worried. The coronavirus is affecting many more people. It's unfortunately killing many more people than either of those did. And so even though those tended to be big, especially H1N1, and tended to cause issues, not nearly to the extent of what's going on right now. So just a better understanding of how that's worked throughout time over the last few years. But Thank you for your questions. They've been fantastic. Again, the headlines, 7 million cases, 200,000 deaths, with projections of possibly 378,000 deaths by January 1st if we don't start buckling down and doing those things that we need to do to help keep everybody safe. And remember, when you're wearing a mask, when you're doing your social distancing, part of that is to keep you safe, but a big part of that is to keep everybody else safe, not just you, but people in your community. And we all need to do that to keep each other safe. Europe is having its own issues. If you look at France, if you look at Spain, if you look at the UK, they're looking at more lockdowns because their cases are going up. Part of the reason that experts think their cases are going up, especially compared to countries like Germany and Sweden, is because those other countries ended up opening up too fast, opening up too quickly, and having people not necessarily do those things, those behaviors that we know can help us keep this under control. And then the last one is the vaccine. There was a Senate hearing with Dr. Fauci, Dr. Redford, Dr. Giroir, and Dr. Hahn, and they all said the same thing. Transparency is key to getting that public trust in the vaccine. We ourselves are going to look at things and making sure that we get comments from the public on these vaccines. We're going to get more transparency in the vaccine approval or authorization process. And they all said, if it looks good science-wise, if it looks good data-wise, and it gets an emergency use authorization based on that science and data, they said they would not hesitate to get the vaccine themselves, and they would not hesitate to recommend it to their own family. We'll keep watching this over time. As time goes on, I'll keep looking at it too and informing you what I'm finding out. And so hopefully that way we get a better understanding of the vaccine, its authorization process, and what we need to do in order to get it once distribution gets here. But thank you very much. I hope everybody has a fantastic weekend. And as I always say, for you, your loved ones, your family, and your community, I hope you stay as healthy and as happy as you can.